delighted to have you as part of the Telstra Health family. And I think as we move Telstra Health forward, we're really looking at delivering digital solutions across the continuum of care, because we've got cancer screening registers, we've got primary health care, we've got pharmacy solution with Fred IT, we've got hospital solution, aged care solution, and costing solutions to support the hospital services. So I guess I'd be interested in teasing out a little bit, where do you think the obvious synergies are with Telstra Health and MedicalDirector?
Yeah, fantastic. So obviously, you're right. The one thing about general practice is it's at the epicenter of a lot of what we just spoke about. You know, they are the primary care community, so they have the patients coming back to the practice normally when they've engaged in some of those services that you spoke about. So we see great opportunity, and we're already doing some amazing things. So already within the year, we've managed to integrate the National Cancer Screening Register more tightly with MedicalDirector to be able to provide that insight for the patient into the doctor's record as well. We're ERX with Fred. One of the other things we did...
That's the electronic script.
Sorry,
yes.
Thank you. Thanks. Yeah, the electronic scripts, we've integrated over the pandemic period again to provide that true electronic script. Once the legislation had passed, we were able to then create those electronic scripts and have them start to transfer to support telemedicine, so that there was a lower touch for the community care that needed to go on. So we've got ERX already more tightly integrated. We've got that National Cancer Screening Register, and obviously aged care and disability. We have a lot of our customers service those facilities, and they walk in and out of those facilities on a regular basis. So again, our ability to now better align our solutions and create more interoperability between them is really exciting. And then obviously the future is to do more and more of those things to support more and more types of care out there.
No, that sounds terrific, and that's where our vision is, to take Telstra Health, so you're part of that vision in delivery. I guess the thing that's getting a lot of media coverage at the moment and high on people's minds, the state of primary care, and in particular general practice across the country. If general practice really is the cornerstone of healthcare in Australia, and we do need some reform in healthcare policy and funding, where do you see MedicalDirector could play a role in assisting some of that primary care reform?
Yeah, fantastic. So I think the key thing is we're an enabler. We are here to support the changes that need to be brought to the services within that community. We can see from our customers, and we hear from our customers, they're exhausted from a very, very heavy workload over the last couple of years. And again, a huge thank you to all of the people that have put their shoulders into that pandemic response, and it's been fantastic. But there's clearly, as an exhaustion in general practice that everyone is acutely aware of. So anything we can do with technology that can take some of that burden away is something that we want to continue to invest in and continue to support. As well as that, as styles of care change and maybe more allied health and more nursing facilities come into general practice, how do we support those additional services so that we can keep that continuity of care happening? So creating tools to help streamline care planning, and also create insight into how the practice is operating. Where should the practices be focused, in their efficiency gains that they need? Mental health is on the rise, tools to be able to support mental health. All of those things are where we're looking, and all feedback from our customers who are saying these are the areas that they're feeling within general practice. And also the mobility and agility of general practice as well, allowing people to operate different models. So using cloud solutions such as Helix, it allows you to liberate yourself from the practice and be a bit more free. And we've got some amazing stories of organisations that are using that new capability to come up with different models of care.
What does the capability of the cloud solution actually look like? Because for non-IT people, the cloud is the mysterious thing that exists up in the atmosphere.
Yeah.
But it does actually deliver timely responses to many aspects of care. So I was interested in your perspectives there.
Yeah, thanks, Elizabeth. So the fundamental thing is that centralisation of all of the infrastructure. So obviously in general practice today, we support many of those general practices with their facilities. With cloud, you get to centralise a lot of those pieces, so you can create efficiency and scale through that. And what it does is it allows the system to be available all the time. Whether you're sitting at home, put your kids to bed, and then come back to the lounge and have a look at your pathology that's come in for the day, it brings the practice closer to you and integrates into your life a lot better. So what we hear from our customers is being able to integrate things that we take for granted, being able to integrate some more of that into your life is valuable. The other one is the fact that it is cloud and is connected. You can be more mobile. You can be in community. So we've got some organisations that are using it with nurses out in the field, and that information flows back into the general practice. So many efficiencies that can be gained from cloud, and they're just the beginnings. The other key thing is obviously with cyber security, and that overall threat, and that threat continuing to strengthen in some ways. We see the cloud as being a great ability for people to put their information safely. And again, now with Telstra Health and Telstra, supporting the organisation, we continue to see that strengthen.
So GPs can become digital nomads.
Yeah. Well,
as the term often is described.
So you combine that with telemedicine and the electronic scripts, and we've got situations where doctors in the pandemic, they wanted to reduce their exposure to society during that very risky phase, but wanted to continue to provide that care. Well, our Helix customers could very simply just be at home, send an electronics, do a telemedicine consult, send an electronic script, all seamlessly, as if they were working from their practice.
Yes, it's extraordinary because so many other industries have made the digital transformation. And health still struggles just a little bit, but we're there to help fix that.